Dr. Matt Bernstein. Welcome to the podcast.
Thanks for having me. Glad to be here.
So, Matt, you have been a practicing psychiatrist for over 20 years.
That's correct.
And you're the CEO of Accord. And Accord has really caught my eye because you provide metabolic-based mental health programs. And like when I saw it, I'm like, hallelujah, hallelujah. Somebody actually approaching mental health from a different and probably more effective angle. Now, before we dive into this, can you just walk through the training required to be a psychiatrist?
Sure.
And maybe give us a couple of career highlights or career lows or what sort of drove you to this space?
Absolutely. So it's like being a psychiatrist is a medical doctor. So first we do 4 years of undergraduate education. I was actually an English literature major at Columbia University.
Oh, wow.
Then I had a little time in between that and medical school, which is 4 years. And then beyond those 4 years, we do 4 years of psychiatry training. 1 year in internal medicine and then 3 years of straight psychiatry.
So you're 12 years in, all in all.
Post-high school of 12 years of training. That's right. Yeah.
It's just crazy.
Yeah.
So kind of 30 years old by the time if you don't take any breaks, by the time you pop out of the training cycle.
That's right.
Okay. And then so you organized the first Metabolic Psychiatry conference in 2023. We had a very, very brief chat before you came on. I've had a metabolic neurologist on who you're familiar with, Dr. Matthew Phillips. And now we got a metabolic psychiatrist, which is really cool. Now, I've got a little insight into this area, mainly through reading Dr. Chris Palmer's book, which I'm sure you'll be familiar with, Brain Energy. But tell our listeners, what is metabolic psychiatry overall?
Sure. So it's really approaching mental health through the lens of metabolic health, with the recognition that the brain is the most energy intensive organ in the body by far, weighing about 2% of our overall body weight, but using usually more than 20% of our overall energy. So the brain requires lots of energy. When the body isn't producing energy efficiently and effectively, it affects brain health first. And we can intervene on brain health through these metabolic interventions. And we've known this for, really actually millennia. In the time of Hippocrates, they used fasting to treat seizures, 5th century BC. And then this was picked up again in the 19th century. There were fasting clinics all over the place. And a very clever doctor at the Mayo Clinic in 1921 used the ketogenic diet to treat pediatric epilepsy.
I remember that, yeah. And it was very effective, wasn't it?
Yeah.
And then we just sort of forgot about it for quite a while.
Well, the neurologists never fully forgot about it. They were studying this all along and using it in treatment refractory kids. So for the first 30, 40 years after that, it was used extensively in epilepsy. But then the medications came along and everyone's enamored with the drugs, right? We can pop a pill, you take a medication, it's much easier. You don't have to completely change your diet. And so that's what neurologists gravitated towards to treat epilepsy. But there was always a recognition that with certain kids, the diet worked much better than the drugs. And there were kids who would be on 2 or 3 anti-seizure medications at a time, still having seizures all throughout the week. And they would switch them to a ketogenic diet. They would see control over the seizures. They could taper them off of all of those medications and still get control over the seizures with the diet. And then what was even more amazing is many of those kids could come off of the diet after 2 or 3, 4 years and still retain control over the seizures. So that period
And is that because they kind of fixed if in inverted commas, the dysfunctional metabolism in certain parts of the brain?
I think we don't really know scientifically exactly why some of those kids can come off the diet and some of them can't. But that was certainly an intriguing thing. There's very few brain disorders where there's any treatment that fixes the problem such that you don't need the treatment anymore.
Yeah.
So that's really fascinating and intriguing, and led to lots of neuroscience research about how are these ketones doing what they're doing in the brain. And so now we've had decades of neuroscientists delving into, what is going on with ketogenic diets and brain health. And there's now lots of studies about that and lots of theories and many mechanisms now that have been identified about how these ketogenic diets improve brain health.
Yeah, I remember going through my nutrition master's degree, and the whole talk about the brain was the brain needs glucose and it just runs off glucose. But then we have seen that the brain actually functions really well in the absence of glucose, and actually in some cases seems to prefer ketones.
Yes. Well, just to clarify,
actually,
it never stops using glucose.
Yeah, correct.
So no matter how deep of a ketosis someone's in, and how helpful that is for their brain, there are certain parts of the brain that are always going to be using some glucose. And so what we do is we're really providing this additional source of fuel, not a complete alternative source of fuel. But in addition, we're getting a signaling from the ketones to tell these neurons and other brain cells to change in certain ways. And we think that maybe, we don't know which is more important, but that's also very important, that signaling that the ketones are giving to the brain.
And I think it's important to know when people are on a ketogenic diet that the body still makes enough glucose.
That's right.
Right, through gluconeogenesis. So it has this whole process that's evolutionarily conserved, that it can make as much glucose as it needs in the absence of a dietary source of glucose. Like, for instance, if our ancestors were not deliberately practicing fasting, but if they went for periods without food. Actually, I want to just take a couple of steps back, and your description about the brain, 2 to 3% of our weight, but 20+%, and particularly in times of chronic stress, or high cognitive demands,
right,
up to 30% of our energy. But and then when you look at it like that, and then realize that compromised energy supply can really affect it. But like when you thought of that, was it like a duh moment for you as a psychiatrist, where you're going, oh my God, this is so bloody obvious. Now that I've seen it, I can't unsee it.
Yes, absolutely. Yeah, I mean, of course, this was not part of my training at all. We didn't learn nutrition in all of those 12 years, college, medical school, residency training. I got almost no training in nutrition, which is very common in the States.
It's very common over here in Australia.
Yeah.
It's very common around the world. I mean, most medical degrees would have a maximum of 2 weeks of nutritional training.
Right.
But for me, that then psychiatry in particular has got no nutritional training. I mean, that's kind of dark ages stuff, really, isn't it? When we know what we know today.
It's true. Yeah. I mean, I think, and there's a lot of resistance in the psychiatric world about this alternative way of seeing brain health and mental health, as you might imagine.
Yeah.
This message that we can have such a profound effect on the brain through non-pharmacologic, non-psychotherapeutic options. And it's not to throw those away. They can be incredibly powerful and life-saving. I've seen medications and other biological standard psychiatric treatments save lives many times. I used to work on an inpatient unit with people who were acutely ill. The medications literally would save lives. We used ECT. It would save lives. I have no doubt. But those treatments are not very good at continuing to make people well after the acute crisis is over.
Yeah. It's an interesting observation, Matt. I'm just today 5 weeks out from open heart surgery.
Oh, wow.
Because I'm very, very lucky boy. I discovered, because I'd play soccer with a cardiologist and asked him if he'd do some checks. I was born with a bicuspid aortic valve.
Oh, wow.
Right? So I'm very lucky, because it probably would have killed me if I hadn't picked it up, or certainly caused heart failure. But what I observed going through that whole hospital system is that we have a very, very effective sick care system,
right,
but not a very effective health/wellness system.
Correct.
Right? It's really all about just treating the disease or the condition, and really not very much, if anything, about then returning to optimal health and wellness and quality of life and all those sorts of things.
That's
right?
exactly right. Yeah, that's exactly how I see things. And as you said before, once you sort of see this way, you can't unsee it. Once you see the importance of the underlying metabolic health to the function of all the cells in the body, not just the cells in the brain, but all over, you can't unsee how important that is. And once you also feel it and experience it, when you achieve some better metabolic health, wow. I mean, the skies part for most people when that happens. And it does take a lot of work. I mean, of course, and I know that this isn't something you do by, hanging out on the couch and getting up and, doing a few laps on a treadmill once or twice a week. Like, this is serious work.
And coming back to your point earlier, lots of people will, and it's human nature, we default to the easier option. It's easier to pop a pill,
right,
and that's what people tend to go towards. And it's harder to change your lifestyle, and it's really friggin' hard to change diet,
yes,
particularly if you've been eating a certain way. And certainly ultra-processed foods, which we're now seeing are quite addictive. I'm not sure if you saw the recent Umbrella review on ultra-processed foods. So a review of reviews of meta-analysis, and found convincing class 1 evidence that increasing ultra-processed foods in the diet increased risk of anxiety by, I think it was 48% off the top of my head, and common mental health disorder by 53%.
Amazing.
Like class 1 evidence.
Yeah.
You don't see that shit in nutrition, right? I mean, this should just be alarm bells for psychiatrists and people all around the bloody country, shouldn't it?
It should. Absolutely. Yeah, the more we actually study it, the more we see how powerful food is. It's really the most powerful thing to control our epigenetics. We're all born with certain genes, but that's really only 10 to 20% of the story of health. The other 80 to 90% is what's going to turn the genes on and off, which is epigenetics. And of course, many things control epigenetics, but food is the one that we have the most powerful control over. It's so powerful, and we can control it. And here we are instead, eating diets that really, do the worst to us.
Absolutely. I think Hippocrates, let food be thy medicine and medicine be thy food, right?
Absolutely.
The ancient Greeks again. So now I know there was a bit of a pivotal moment for you in your journey, and it was around your son's mental health journey. Could you tell us a little bit about that?
Sure. So, here we are. We have 3 boys, and we're talking about 8 years ago now, almost. We have twins at the time who were 14 and another one who was 12. They were very happy, well-adjusted kids, going to school and playing sports and music and friends and all these things. And I'm a psychiatrist. My wife's a psychologist. Some people might say our poor kids, they've got double shrink parents, of course. But they were doing great. And then all of a sudden, 2 of my boys, one of the ones, the twins, who was 14, and the other one who's 12, got very, very sick, both at the same time, which is very unusual. And it looked very psychiatric, mental health, in the beginning. They got acute depression, severe anxiety. But when we started really looking closer, they had a lot of physical symptoms and really severe cognitive symptoms, which one would not expect from just, depression and anxiety in kids. They could not even go to school. I mean, they really just had to drop out of life. It was that severe. And it really almost happened overnight. And so too, at the same time, we were wondering, what happened? Did we do something? But it really pointed to, potentially something environmental or infectious that, would cluster together like that. Well, it took quite a while to figure out, but eventually we learned that they had a form of autoimmune encephalitis, which is essentially the immune system attacking parts of the brain that were causing these mental health symptoms. We got no help from traditional medicine. I mean, literally none. And here I am. We have great resources. I know a lot of people. I'm a doctor myself in Boston. We could get no help from traditional medical care at all. And eventually sort of went into this medical odyssey, working with functional medicine providers and environmental medicine providers, and eventually got them well through very intensive treatments of infections and their immune systems that traditional medicine didn't provide.
Wow.
One of my sons is still, unfortunately, sort of had a relapse during COVID, and so he's not all the way well yet. But at one point, he was almost all the way well from those treatments. And really what it taught me was that we don't know everything. And in fact, we don't know a lot about the body and biology and the brain. And, it really made me rethink how many of my own patients have something physical going on. I mean, as you probably know, psychiatric diagnosis, mental health diagnosis is not based on valid biology. We sort of gave up validity in psychiatric diagnosis with DSM-3.
Yeah, I have talked about this quite a few times, that there's, I think DSM-5, and you correct me if I'm wrong, maybe is 106 identified conditions, and not one of them has a consistent biological signature.
Correct. So we don't use biological markers in psychiatric diagnosis at all. We try to rule out a few things. If someone goes to an ER, they'll get a chemistry panel and a complete blood count, and they may get an EKG, or if in very rare circumstances, they might get a CT scan of their head if they're a first episode of psychosis. But that's kind of the end of the medical workup most of the time. And I just start thinking to myself, my kids had a condition. If we didn't dig deeper, my wife and I, they would have been lost to, they have a mental health condition that no one can treat, no one can help. And how many of my own patients have we sort of done the same thing to? Have we abandoned? They have there's a physical basis to what's going on in their brains, and yet we just put them in this diagnostic category, give them some medications that were essentially fiddling with neurotransmitters, which may be somewhat effective, as I said, sometimes life-saving in the acute setting, but very rarely or almost never does a psychiatric medication get someone all the way back to wellness. True wellness, where they're back to their functioning, they're back to their normal social roles. The medications just don't do that almost ever. And sometimes with psychotherapy, we can get almost all the way there, but we're missing something in my field, clearly. And so then I was sitting in a grand rounds lecture at McLean Hospital, part of Harvard, and my colleague, who I knew from way back when I was a resident during my training, Dr. Christopher Palmer, who you mentioned his book, is giving a lecture on ketogenic diets and psychosis, and showing data about how ketogenic diets can help the brain, and then showing some case reports of some people with chronic psychotic disorders who were on the strongest medications still having psychotic symptoms, and having those symptoms completely reversed by a ketogenic diet. Wow. And I'm sitting there and my jaw hits the floor, and literally I think most of the people in the room didn't quite believe him. But I knew him. And I knew he was telling the truth. And I'd already had my own experience with my kids at that point, and I knew that, there's more to the story. And here he is, telling me what more to the story there was. And I was sort of off to the races learning more about that at that point, and then trying to figure out how am I going to apply this to my patients, which is a big challenge, which we can get into.
Yes, and now just before we move on, I just wanted to say that as a fellow dad, I really feel for you with your kid's journey. Having had my little guy went through Cushing's disease, which is pretty horrible and has pretty horrible mental health effects that nobody even bloody looked at. And yes, when medicine was fabulous to the point of getting the tumor out,
right,
but then absolutely useless in terms of his recovery. And we had to go and work with a functional medicine doctor and do all sorts of different things,
right,
slightly alternative to get him back to wellness.
Right.
So, yeah, look, I just want to say I feel your pain, and I know how motivating it can also be to go and try and find something that's actually going to work. Now let's getting back to this whole idea of metabolism in mental illness. How much of mental illness do you think has a strong metabolic component?
It's a great question, and I don't pretend to know the answer to that. We're still so early in the science of really understanding how powerful these metabolic treatments may or may not be in mental health disorders. But what I can say is that for the people who respond, it can be really incredible. And then the people who even have a lesser than incredible response, there's still profound and powerful, important changes that are going on that we see. So at the minimum, I tell people, if you're going to do this, it's a lot of work, but I can guarantee you that you're going to feel more energy, you're going to have better sleep, you're going to have a better concentration and focus. Those things are almost universal for anyone who's done a program of improving their metabolism and really improves their metabolism. We may also get, bonus things like, stabilizing your mood if you have bipolar disorder, or reducing your psychosis if you have a schizophrenia or schizoaffective disorder, or reducing your obsessions if you've got OCD. I've seen all of those things happen in people. And it's at this point, again, the science is so early, it's hard to predict how much of a symptomatic benefit people are going to get, or maybe how long it might take. I mean, that's the other part, is that for some of these people, it may be that this is a treatment that could, give them some immediate benefit as soon as they're into ketosis. Some people start feeling the benefits. And for other people, it may take quite a few months or even many months for them to get all of those benefits. But the benefits accrue over time. As the metabolism continues to improve, as the mitochondrial health continues to improve from that ketone signal, the benefits keep accruing.
Now, look, we'll dive into the role of the mitochondria in a minute and really into the ketogenic diet. But just really, if we take a step back and look at first principles here, kind of like, the observation earlier on that the brain, is only 2 to 3% of the weight, but uses 20% plus of energy. I like to think of these things from the perspective of the human genome. And I remember there's a legendary exercise physiologist, Professor Frank Booth, who in a research paper in 2012 said the human genome hasn't changed in over 45,000 years.
Right.
And he said the current human genome requires and expects us to be highly physically active for normal functioning. But then you add on a couple of things to that. And if you just look at our species, the evolution of our species, we've always moved a shitload more than we do
had
today.
to survive, right?
We had to,
Right.
absolutely. And now the research around the role of myokines, these signaling molecules from contracting muscle and how they impact every friggin' organ, including the brain, this is in your face, right? But then, nutrition, we have always as a species eaten natural foods. And the enzymes in some of those foods, they work as cofactors for our metabolism. And it just, for me, is pretty friggin' obvious that then you take this genome and you stop it moving or reduce its movement. You then do two things in nutrition. You reduce the amount of good nutrition that it's really depended on and depends on metabolically, and you replace that with a whole heap of ultra-processed shit, which we know is doing damage. And then if you throw in lack of sleep as well, which you know as a psychiatrist can cause mood disorders in and of its own, and a whole heap of overstimulation, good luck with your mental health.
It's so true.
That's what I say to people.
It's so true. The modern world is an absolute setup for poor mental health. It's not individual people's fault. I mean, I think that's really important to say, is that the system is set up for people to have poor mental health. Everything you described is 100% true. And I would add in, we evolved to have light as a nutrient as well.
Yes.
The right amount of blue light in the morning and no blue light in the evening and throughout the night. And that was such a powerful way to control our circadian rhythms, and our whole biology is controlled by those rhythms. And we've also messed that all up by being indoors all the time and having blue light at the wrong times at night, which is the most powerful signal for our circadian clock. But absolutely, the exercise thing, you make me think of this book I read by an anthropologist, Dan Lieberman. He's at Harvard.
Born to
Well,
Run.
he wrote Exercised also, which is an interesting one. It's all about how we did not evolve to choose to exercise ever. In fact, we evolved to conserve our energy, because throughout our evolutionary history, we were barely surviving. Food acquisition was the biggest challenge for survival, and predators, of course. But food acquisition was really the main thing. So that means we were going through periods of time where there was no food or no carbohydrates, in and out of ketosis all the time. So we certainly evolved to have ketones. Ketones were part of our survival mechanism, which I want to go into as well. But we had to move so much to survive. Whenever there was a chance to rest, our brains, of course, were evolved to choose to rest. And here we are. We have no survival need to move anymore.
Yes, correct.
And so, of course, no one wants to go. It's not in our brains to want to go and exercise. I mean, of course, those of us who do, we've taught ourselves that this is good for us and that we'll feel good and that there's really good reasons to do it. And then it becomes a habit. And of course, we feel all the benefits of it. But most people don't do it because we didn't evolve to, wake up and decide I'm going to go run for no reason. And
absolutely.
in persistence cultures, subsistence cultures now, in traditional cultures, people look at the idea of exercise as the craziest thing they've ever heard. Because he goes and talks to these people, and in the remote parts of Africa, and
the Hadza.
the Hadza. They don't exercise for exercise sake ever. No, they sit around if they can. And of course, they still, because of survival needs, will get, a good 10, 12 miles a day. But they will never choose to do it if they don't have to.
Yeah, absolutely. Look, we are absolutely aligned on this. I wrote a book called Death by Comfort, Why Modern Life is Killing Us and What We Need to Do About it. And it was that whole idea that we default towards comfort and relaxation because of exactly all the stuff that you just said. So now let's now then talk about the role of the ketogenic. So you've mentioned a number of times the ketogenic diet, and let's use that as a segue into metabolic treatment versus medication treatment. So obviously you're an expert in both camps right now. So just give us the overview on that, and dive as deep as you want into how a ketogenic diet and ketones in particular play a role here.
Well, there's so many ways I can go with this, but the one thing I want to say at first is that, and I know you know this, is that we don't have a lot of deep knowledge about how psychiatric medications help with mental health disorders. And in fact, the prevailing theories, for example, the serotonergic hypothesis of depression has been challenged, and I think very much.
I've had one of the authors of the seminal research paper on this podcast.
I know exactly what you're talking about, the umbrella research article from the group in London. Yes. So, all we know is that we can fiddle with these neurotransmitters and we can get some percentage of people a reduction in symptoms, not a huge percentage of them, and certainly not all the way to wellness and with a lot of side effects. Meanwhile, on the other side of the ledger, with this metabolic approach, the ketogenic diet, as I alluded to, the neuroscientists have been studying this intensively because they've known the ketogenic diet works in epilepsy, and they're trying to figure out, well, how does it work? Of course, I think the main motivation for a lot of them is, how are we going to find a drug that mimics what this diet does? Because it's hard to get people to do the diet. But we now know that there's at least 7 main mechanisms of how this diet works. And I can go through them. We've already alluded to some of them, but one is this alternative source of fuel. And that one's important. I'll go into a little detail about that. The brain becomes insulin resistant, just like the rest of the body does. And in mental health disorders, it may be that the brain is insulin resistant well before the rest of the body. The different organs get insulin resistant at different rates. And so when the brain is insulin resistant, it can literally be bathed in glucose, but not be able to get that glucose into the cell to burn for energy. And the ketones...
Type 3 diabetes, right? Type 3
exactly.
diabetes.
So that same mechanism may be at play with mental health disorders, or at least some of them, or some of the people that have them. And we bypass that blockade, essentially, by getting ketones into those neurons, and it doesn't need insulin to get in. And so in that case, some people will get that immediate effect from ketones. Even exogenous ketones will give them a huge mental health boost, or even something like MCT oil, which has the liver make ketones out of it.
That's a really important point that I just want to double click on, Matt, that and again, those first principles, if your neurons are not getting the energy, they don't work, they stop working, and then you're going to have compromised brain function, which can manifest in a range of different psychiatric conditions.
Absolutely.
Right? And then you restore the energy, the neurons start working again, the brain starts working again. I think that's really important for people to understand. I just wanted to really emphasize that.
Thank you. Yeah, I agree. That's important to double click on for sure. So that's the first mechanism. Second one, I would say, is this improvement in mitochondrial health. So the ketones are a signal for mitochondrial biogenesis, but also for mitophagy. Essentially the recycling of the old, damaged, non-working mitochondria, breaking them down for parts and making new, good, well-functioning mitochondria. And people might remember from their high school biology that mitochondria are the energy factories in the cell, which they certainly are, but they do many other things, right?
A shitload more than just produce energy. We've actually had a whole podcast on the mitochondria with Dr. Christabel Yeo.
Oh, wow.
So anybody who wants to dive into that can go and look at that. But yeah, I mean, I'm all over this like a spider monkey, that mitochondria. But isn't it amazing, just as a little aside, how the cell and even in the mitochondria, how it recycles this mito-autophagy, that how friggin' clever and how there's no wasted resource within the cell.
That's right.
It's constantly recycling stuff to recreate energy.
Well,
pretty friggin'
it's
cool.
amazing. The whole process of autophagy is absolutely incredible. We recycle everything. All of our cells get recycled, not just the mitochondria, but our cells and our tissues recycle. In fact, if you look at like one of your muscles, your biceps, let's say, that bicep is not going to be, there's not going to be a single cell that's the same a year from now that's there now.
Yes.
It's just incredible. We keep recycling ourselves. We're not the same cells. Now, there are some cells that stick around and don't recycle, neurons in particular. But muscle cells, they'll just recycle, turn over. We got a whole new set of them, whole new muscle, in a year. Absolutely incredible.
Yeah, that's right. And most people have got no idea about that, right? I talk about change in cellular change. The only reason we're still alive is that we're constantly recycling our cellular.
So we need to take care of our recycling. And one of the ways we get ourselves to recycle is having some periods of time when we're not eating. That helps with autophagy. Yes. Exercise, for sure. Ketogenic diets are very powerful signal for autophagy and especially mitophagy. So that's our second mechanism. The third one is less oxidative stress. So when we burn fat for fuel, it's much cleaner than burning glucose for fuel. And so we are producing less oxidative stress. People are so interested in taking antioxidants, which I'm all for as well. But even more powerful is just let's produce less oxidative stress in the first place. And if we can reduce some of the simple carbohydrates, get our bodies to be burning more fats and ketones in the brain versus glucose, we're going to create less oxidative stress in the first place, create less of that damage, less energy is needed to squelch the oxidative stress.
Absolutely. And I think most people don't realize, most of the ultra processed foods are simple carbohydrate based because it's very, very cheap to produce and highly profitable. And most people don't realize about aged glycation end products that we get from the digestion of these simple carbohydrates, and that causes oxidative stress and inflammation at a cellular level, which just wreaks havoc on your metabolism, doesn't it?
Yes, it does. Absolutely. And just, how much resources need to be put into fixing all that damage.
That's a good point, actually. The antioxidant defense systems and stuff like that. Expensive to run this stuff, right? It is.
So you already mentioned the fourth mechanism, which is inflammation. So the ketogenic diet reduces neuroinflammation. We now know that inflammation is a huge component for most of the mental health disorders. It's been most studied in depression. There are actually studies that show that people who are depressed, who have elevated C-reactive protein, their depression responds to anti-inflammatory drugs. And so, and that's been replicated a number of times, actually. Yeah.
And I've seen studies actually on turmeric and curcumin being pretty effective as an antidepressant, and actually out of Iran on looking at saffron.
Yes.
Which is anti-inflammatory as well.
And it's good for anxiety.
And really effective.
Yeah, saffron's good for anxiety, actually. But, of course, those are not nearly as powerful as the reduction in inflammation we get from a ketogenic diet.
Boom.
So that's the fourth. Fifth one I'll talk about is neurotransmitter based. So ketogenic diet produces an increase in GABA, which is our calming neurotransmitter, the one that people are looking for when they're taking a drink of alcohol or taking a medication like a benzodiazepine, like lorazepam or diazepam, clonazepam.
Or Valium.
Yeah, the brand name would be Valium or Ativan, Xanax, those the brand names. And the ketogenic diet also reduces glutamate, which is this excitatory neurotransmitter that we certainly need, but too much of it causes lots of problems. And in fact, a study just came out today, I think in the British Journal of Psychiatry. A group in University of Edinburgh did a pilot study on ketogenic diet and bipolar disorder. And they didn't have a control group. There are controlled studies going on now, but most of the ones published so far don't have control groups. But they saw a really nice response to bipolar with the ketogenic diet, dose response as well, so that the higher the ketones, better response. But what they also did is magnetic resonance spectroscopy of the brains, and what they saw is a very significant reduction in glutamate in these people whose bipolar got better from a ketogenic diet. And this is really cool because the other things that reduce glutamate are anti-epileptic drugs. And also when people with bipolar recover from any mechanism, they get a reduction in glutamate. But this was the biggest reduction in glutamate that's been seen from any intervention, was the ketogenic diet. So that's really exciting because we're now seeing some really good hard science associated with the clinical outcomes in that study, which is very cool.
That is very cool, actually, and the dose response, that's a telling thing as well, isn't it? When you see that dose response for people, I think we are a glutamatergic society.
Yes.
we really, because we're just always on,
That's right.
And this is what a lot of people don't realize. And glutamate's been highly implicated in depression as well.
Yes.
And then because glutamate, I think it's important for people to understand that excitotoxicity that can happen with too much glutamate. Basically, the nerve cell can fire itself to death. And actually, my mate, Professor Grant Schofield, showed me research that when a cell, a neuron, dies from excitotoxicity, it actually spills out glutamate and inflammatory compounds that then infect and have a negative effect on surrounding neurons. And there can be like this negative domino effect.
Yeah, very interesting. Yeah.
And I didn't realize that a ketogenic diet increases GABA, which is the balance. I mean, everybody hears about serotonin and dopamine and all of these things, but there are dominant neurotransmitters, aren't they? Glutamate and GABA. And if they're not in balance, good luck.
They're all over the brain. So, right, there are systems that use serotonin. There's some systems that use norepinephrine, some that use dopamine. But the whole brain is running on GABA and glutamate. I mean, it's the brakes and the gas. It's like the basic fundamental neurotransmitter systems in our brain. And they've got to be in balance. And as you're right, modern world, as we talked about, is very pro glutamine and very short on GABA.
Absolutely.
Yeah. So one, we got two more.
So what's the sixth one?
So two more. One is really an overlap with exercise, but the ketogenic diet on its own increases BDNF, brain-derived neurotropic factor.
That's interesting. Yeah. Okay, because I knew that that omega-3 fatty acids can increase BDNF. I did not know that that a ketogenic diet produces BDNF. My listeners will be very familiar with BDNF. I'm banging on about it all the time. I think somebody once described it as miracle grow for the brain. I think you guys used to have miracle grow in the States, right?
Yeah. So the way I describe it is all these neurons have these fine little branches, and they connect to not just a few other neurons, to hundreds and sometimes even thousands of other neurons that process these. They call them dendrites, and they almost look like the branches of a tree. So they call that arborization. And what BDNF tells these neurons to do is make more branches, arborize more, connect to more neurons. And the more connections, the better. So we really need this stuff for our brains to function optimally. It's one of the things that exercise is very good at producing more BDNF, but ketogenic diet also does that on its own. And so you're doing both. You get that, double effect, essentially.
Yeah, Matt, I wanted to ask you about, because I remember years ago, and I don't know where I saw the paper, but it was suggesting that some of the antidepressant medication, it was like, well, if it was about serotonin, these antidepressants can impact on serotonin because they inhibit the reuptake pumps, as you well know, right? But that happens instantly, but people generally don't see an effect for weeks. And I remember reading a research paper that was suggesting that some of those drugs could increase BDNF, and they thought that it was the increase in the BDNF, not the change in serotonin, that could have an impact on some people.
I've read those.
Any thoughts on that?
I've read those studies too, and I think there is something to that. But again, like most of the research with antidepressants,
go ketogenic. Yes.
There's just not that much there. Maybe it's BDNF, but here we have much more science with the ketogenic diet about raising BDNF. It's a solid mechanism. And we know that it does it. Yeah, it's not,
and it doesn't come with a ridiculous list of side effects.
Correct. And so the last one is the microbiome gut-brain axis. So we know that the ketogenic diet
wondered if that
changes the microbiome, and we know how powerful the microbiome is as a mediator between this gut-brain axis, which is a really powerful impact on brain health and gut health. It's this bi-directional communication, incredibly powerful signals through neurons, through chemicals, through hormones that are going back and forth all the time. I like to say, if someone comes in to see me, if they've got a significant depression, anxiety, I ask them about their gut health. Almost universally, there's gut health issues. I almost never see someone with a healthy functioning gut if I ask. Most psychiatrists don't ask. In fact, I didn't ask until I learned about this stuff because it wasn't part of my training, but it's absolutely important. And the ketogenic diet improves and changes microbiome composition in a way that improves brain health. We don't know all the details yet. I mean, if we knew all the details about the microbiome gut-brain axis in general, we'd have very powerful treatments at our hands. And we know it's powerful, but we're at the infancy of really understanding how to manipulate it and what really makes a healthy microbiome, what really makes, what really works for brain health. We're just seeing little glimpses of magic so far. We don't have all the answers yet.
Yeah. I think anybody who tells you they know exactly what a healthy microbiome looks like is full of mad dog's crap. That's my view on this. It's just, as you say, it's in its infancy, but we know it plays a massive role. Right.
That's right. That's exactly how I see it. I mean, we can measure all the bacteria species by DNA analysis, and you can get this nice report and spend hundreds of dollars. But I think you're right in saying that if anyone tells you they know exactly what that means or exactly what you need to do to fix that, they're lying to you. It's a nice story to say, okay, now we can do all these interventions, but we just don't have the science to know that those interventions really make the changes in the microbiome that we need to make. It's all, it's associational at this point. But we do know that avoiding the chemicals that ruin our microbiome, eating things that nourish our microbiome, fiber, polyphenols, probiotic foods like fermented foods. We know those things are important for microbiota health. We just don't know exactly how to manipulate it in a very specific scientific way yet.
Now, that leads to an interesting question. So depending on the type of ketogenic diet that people go on, they could have very low fiber in this, and some researchers around the gut will go, well, you have to have a lot of fiber for a healthy gut, right? Because, and particularly around the short chain fatty acids that are produced. But as my mate Professor Grant Schofield, who's a big fan of the ketogenic diet, says, butter produces butyrate. Right. And so there are things in a ketogenic diet that will actually supplant or replace fiber as a substrate. But is the and this might be just guesswork here, but when people have mood disorders and they go on a ketogenic diet, do we think the impact on the microbiome is more of they're now not eating all of that shit that is disrupting it? Or is it the stimulation of certain things from elements of the ketogenic diet independently?
I don't think we know the answer, but I agree with your first point that it's so powerful to remove the chemicals and the preservatives and all these things that we know are toxic to the microbiome. So at the very minimum, when we put someone on a ketogenic diet, they immediately are going to eat a lot less processed food. You just can't.
You ain't eating ultra-processed shit on a ketogenic diet, right?
You're going to be making much of your own food yourself, or you're going to be obtaining it from a place that's using whole foods, because that's the only way to get the macronutrients right. And so most likely that's the biggest factor. I personally, and again, I don't think the whole story is out here yet. I like to hedge my bets. I think there's some good evidence about fiber and polyphenols from plant foods being really good for our health in the long run. There's actually some interesting work on polyphenols giving signals to the mitochondria that are very similar to what ketones do to the mitochondria. The genetics overlap quite a bit. They're both hormetic things, hormetic
Yes.
stressors. Polyphenols are a hormetic stressor. But I think...
Can you talk a little bit about that?
Yeah.
Because Mark Mattson, I remember, Jesus, 2013, reading a research paper by Mark Mattson about hormetic dietary polyphenols.
Right.
And I'm a huge fan of hormesis.
Right.
Me and Grant, who I talked about, are starting a lab called the Hormesis
I love
Lab.
it.
So just go down that pathway a little bit for people and have that understanding. Because like you, I'm utterly convinced about polyphenols. The fiber story, we can see a healthy microbiome with less fiber and more fiber.
Right.
And I don't think we know all of it. But anyway, back to hormetic polyphenols.
Yeah. So, polyphenols are compounds in plants. There's about 8,000 of them. They're just a group of chemicals, and there's 8,000 different types. Some of them have been studied to have, some really interesting health effects. You mentioned curcumin before. That's an example.
Yeah.
Resveratrol is another example. Allicin,
sulforaphane.
Interesting, medicinal properties. But essentially what they often are doing is they're causing stress or hormetic stress to the cell. And of course, and your audience knows the idea of a hormetic stress is that it's going to cause a stress that the cell will need to adapt to and get stronger by adapting to it. Now, I think, for some people, a very, who don't have a healthy gut, this can be problematic because if there's holes in the gut wall, let's say, these polyphenols are getting into the bloodstream unchanged, unmetabolized. Because really what often happens is the polyphenols are getting metabolized by the microbiota. They're food for our gut bugs. And they're metabolizing them, turning them into a different chemical that maybe could be useful for us. And so it's this synergy between eating plant foods, a healthy microbiota, and a healthy gut wall that may be what's really working. And so for some people, I think it is really important. They need to actually reduce their plant material. And some people can heal their gut by going to a low plant, low fiber diet, these carnivore diets, for example. And there's
100%
really interesting, idea of, healing the gut that way. My hope is that for some of those people, they can heal their gut and maybe get back to adding in some of these plant materials. Now, a lot of them don't want to. They say, I've never felt better in my life. I am done with plants, and they're never going to go back. And that's okay. I mean, they're doing great. That's fine. But I do think there's potential benefits of these hormetic stressor polyphenols. I do think there are potential benefits of different types of fiber if the gut is functioning well and the microbiome's functioning well. So I like to include that. But if someone's really having gut issues, we'll start eliminating some things. And carnivore is really almost like the ultimate elimination diet to heal the gut, right?
It is. Right. Yeah, absolutely. And you will see a bucket load of people who say that they healed their gut on a carnivore diet. And I think you bring up a really good point, Matt, is that I think nutritional recommendations should be conditional, right? So you talk to anybody who has a problem with FODMAPs. You give them. So my wife has got a little bit of an issue with some of the FODMAPs things. She eats garlic or onions, which she loves, and her stomach just absolutely blows up, right? So this is the thing where it's conditional, right? It's anybody who says always or never. You should listen to them. Right?
That's right. There's no one diet that fits all. We need to individualize it to that person and for that time in their life, and it might change over time for them. What's needed. There's no perfect
really
human
important.
diet that doesn't exist. Right.
And there's no perfect human diet or there's no one diet that is going to be optimal for you throughout your life course. Having certain conditions can then change it, like you said. Right. That's really important. That is a tour de force of the impacts of the ketogenic diet and how they actually do it. So. And then let's just talk a little bit about the mitochondria in general. How big a role do you think the mitochondria play, and what other support other than a ketogenic diet? So just before you answer that question, you said earlier on about light and the importance of light. I don't know if you've seen some of the studies around photobiomodulation and the use particularly of near-infrared light for neurodegenerative diseases. Like, I nearly fell off my chair when I was reading that, and I actually have a red and near-infrared light panel that has actually been really useful for my recovery. But the shit that happens in your cells with different wavelengths of light and how the mitochondria react to them, it's just mind-boggling, isn't it?
It is. Yeah, the mitochondria are absolutely central to metabolic health. Not just because they're the ones producing the energy in the cell, but they're involved in the whole process of energy accumulation, acquisition, and distribution. So many of the steps. They're involved in the first steps of hormone synthesis, neurotransmitter release. They're turning genes on in the nucleus, turning them off. You know, they have an intelligence, and they react to certain things. They get energy from wavelengths of light, as you were mentioning, photobiomodulation. They're reacting to the stress in our lives. They've been able to actually see under the microscope mitochondria change when people are doing a meditation. They react to They react to someone meditating. They huddle around the vesicles as the neurotransmitters are going to be released. They have an intelligence, it seems, that we're finding, that I think we're, again, just scratching the surface, just like we're scratching the surface of the microbiota. And, you know, I think all of the metabolic psychiatry program that I want people to follow is focused on mitochondria. So ketogenic diet, of course, we've talked about. Exercise, which is, of course, is huge for mitochondria. And mind-body practices, which I just talked about, these mitochondria reacting to the stress response and the relaxation response, and circadian rhythms with light. Getting that morning sunlight, getting the hormones in balance, cortisol and melatonin in balance at the right times, and then also getting that direct energy source from the best source of light of all, which is our sun. You know, we need people outside more. And so that's the whole program. That's what we do at Accord, is all of those things, and avoiding these metabolic disruptors like processed food and chemicals in the water and blue light at night and all these things that will disrupt our metabolism and our mitochondrial health. So if someone does all of it at once, that's the idea, is that, you know, immerse someone in the whole program and teach them how to do it so that when they go home, they can continue all of these lifestyle changes that they made and continue to accrue the benefits over the course of many months.
Yeah, we need to take you and clone you and just have rapid reproduction. So to tell me, what sort of benefits are you seeing at Accord? Like, and what sort of people come to you guys, and what sort of results are you seeing? Because this is the most comprehensive mental health intervention that I've ever heard of.
Thank you. Thank you so much. We've had people with many different diagnoses. So we can take someone who has almost any mental health diagnosis. They have to be stable enough that they can do this program. They have to be motivated enough to want to do this program. So they have to have made a decision that they want to use diet and exercise and mindfulness and sleep rhythms to work on their problem, and we're going to help them do it. We're going to give them a lot of support and a lot of teaching, and we have a chef there who's making delicious food, so it makes it very easy to do the ketogenic diet when she's cooking the food, and we have a dietitian crafting the meals. So we've had people with bipolar disorder, type 1 and type 2, schizoaffective disorder, major depressive disorder, OCD. Many of these folks have had comorbid PTSD, because almost everyone in the mental health world has, traumatic experiences. But we can take people who have some anxiety and ADHD, and they'll get a tremendous response. And we've just seen incredible outcomes for the people who do the program. We're monitoring their blood work, we're monitoring their ketone levels, continuous glucose monitor, body composition scans, and mental health rating scale. So we're seeing the results, and they're just really, really mind-boggling results that we're getting through these interventions in ways that traditional psychiatrists just would not have expected. And, to be honest, I wouldn't have expected, 5-6 years ago, if someone told me that I was going to be running a program like this and getting these results, I would have laughed.
Wow. And are they all inpatient? Do they have to come in and stay with you guys to get the sort of full immersive experience?
It is an immersive in-person program. It's a very small program. We're just getting started here. But we have 5 beds, and we can have people who live nearby can come for day treatment if they want to just come and eat all their meals and get all the education and all the programming. They can then go back and sleep in their own bed at home if they want, if they live close enough by. Yeah.
Yeah, that is amazing. Tell me, last question. What are you excited about in the future of the mental health landscape? And what are you concerned about as well?
Well, what I'm excited about is that right now, as we speak, in early 2025, there are many randomized controlled trials of the ketogenic diet in mental health with basic science components along with it, meaning they're doing neuroimaging, metabolomics, genomics, going on right now. And so the data and the papers that are going to come out in the next couple of years, I'm just over the moon about what we're going to see in these papers. We're going to learn so much about what works, how it works, what's going on in the brains, what's going on in the metabolism during all of these interventions. So the science that's going to come out, I'm just so excited about. I think what I'm worried about is what happened in the epilepsy world, which is that they knew that the ketogenic diets work, and they knew that they would work even when the medications wouldn't work. And there's 12 randomized controlled trials showing that they work in kids and adults in epilepsy. And still, it's not even in the first line treatment or the second line treatment or the third line treatment. And so that's what I'm most worried about, is that we can show how effective this is and show how amazing it is. And the field of, my own colleagues are going to turn over and say, well, we can't get people to do it. It's too hard. So let's forget about it.
Yeah. And let's go down the drug
route. Right. Or some of the other exciting things. There are other exciting things happening in mental health with psychedelics and some brain stimulation. Some of the TMS studies that have come out are really exciting. And so, those are more medical. They're not diets. They're not exercise. And so I just worry that everyone's going to gravitate towards these, medical things that are exciting too, and miss what I think is the headline, which is that the metabolism is the underlying, basis, the foundation of the brain's health. Those other things are great if someone gets into trouble, but let's work on the foundation for everybody first.
Yeah, get your metabolism right, and your physical and mental health will thank you for it for your entire life. Right.
That's right.
We just can't get away from the fact of what our genome requires, going back to what we talked about earlier
Exactly.
on. Matt, this has been absolutely bloody awesome. Eye-opening and inspiring in equal degree. Where can people go to find more about you personally and Accord in general? And do you have any plans in the future to try to be able to scale this intervention? I get the inpatient requirement at the minute, but is there any plans on that?
Absolutely. Would love the idea of scaling this up. And I think we need to demonstrate what we can do, how powerful it is, what are the ingredients that are most important. So that's sort of the phase where the field is now. But people are absolutely very interested, including myself, in figuring out how do we provide this to way more people at way less of a cost. How do we make this easier for people? And especially people with a mental health condition. So again, ketogenic diet might be challenging for regular Joe out there, but add in this person has a pretty significant depression, and it becomes even more challenging. So that's
hence the requirement for the in-house.
Right. That's why it's not just online, do it at home. Some people can do it that way, and I love it when people can do it that way. But many of the people that I work with, my clients, need more support than that to do it at this point. In terms of where people can find me, I'm on LinkedIn. I'm not a big social media presence, so people aren't going to find me on, X and Instagram.
You and me both.
I'm just not out there. But they can find me on Instagram. If anyone wants to message me on Instagram, I always connect with them there. And then people should look at the Accord webpage. So accordmh.com is the web page for Accord, and the people can learn all about the program there. And if someone has any interest in, we have had people come from other countries already. If someone from your neck of the woods, or people listening all over the world, if they want to come to Accord to get this treatment, we would love to have you. Unfortunately, at this point, it is a private pay, fairly pricey kind of program. Again, we'd love to make this, easier and inexpensive for people. That is the goal for sure. But at this point, this is sort of where we are. This is how we have to start.
Yeah, mate, I get that. And hopefully at some stage governments will then, as you guys grow and get your efficacy, have a look at this and think about the long run.
Absolutely.
Yes, these intensive interventions can be expensive. But what's the cost of somebody having a serious mental health disorder for 20, 30 years? And even just the cost of the medication.
The cost of the medication is tremendous, but think about the lost productivity. Think about the costs of their families and the lost productivity there. Think about the pain and the anguish that they and their families have to go through. We can avoid a lot of that, I think.
Yeah, awesome. Dr. Matt Bernstein, you have been awesome. Thank you very much.
Thank you so much.
I'd love to have you on again at some stage.
I'd love to come back. It was a really fun conversation. Thank you.